In a second, I record. Well, hi everybody. Welcome to Dr. Hogan GWCIM YouTube podcast. I have a special pleasure today to have Dr. Leslie Mendoza Temple. We've been working forever together on topic of cannabis, and today is 420, so we figured we should talk a little bit. Congratulations to everybody. We were just joking, saying don't smoke your brains out today. Obviously, it's a celebratory day for cannabis, and on Saturday, actually, nationally, I'm going to be in a well, it's not downtown, at the large stadium. We have a national cannabis festival. It's an annual event, so it's on the first Saturday after 420, whatever it comes to, doing a book signing and also just representing Doctors for Cannabis Regulation there for a couple hours. But I thought let's get together and talk. I mean, Les, you and I have been kind of the loud voices at the consortium of academic health centers on trying to bring sense to this topic to academicians. Some of them are quite resistant. We went quite a long way from where we were 10, 15 years ago. And I know you've done tons of stuff in politics in Illinois. What do you want to tell us?
Well, I think about what a long way we've come. In Illinois, the medical cannabis law was announced in 2014. So count how many, I'm not good at mental math. I read an article in the Tribune that said it's legalized now for medical use. And I thought, oh, I think I need to know more about this, because what kind of training did you and I get in medical school and residency, where all of the problems that cannabis can cause? And even then, it wasn't that much conversation.
Right.
Then as people would start trickling in, they'd read the paper and they said, I want to get certified now. I thought, well, I want to see you in a neck brace in a wheelchair and looking like really, really sick. I was nervous about this. And even as I would certify people, I would learn that just because a law comes into place doesn't mean that everything's being executed very well. So the dispensaries weren't even open for a year, and I was already getting approached to certify. And I would certify, and at some point I'm like, you can have the privilege to walk into a dispensary and buy it, but there was nothing open. There weren't even any businesses. So the cart before the horse was put out, and I would prescribe dronabinol because as a prescription synthetic THC, that's all we had. And it really was an interesting bridge to use that and get people exposed. And then eventually the first dispensary opened November 2015. And now we fast forward to 2023. We've got multiple medical med-rec dispensaries and a social equity program in Illinois that has caused a lot of log jams. Very well intentioned, but so much politics, even more so.
And Illinois, the one state of Illinois now gives as much recommendations as the entire state of Israel. The populations are about the same. So it became one of the leading programs in the country, I think, right? Partially because you were involved and you were as a medical voice of reason. There's a lot of programs have been established in different states that were basically like purely legal. I remember in district, that's exactly what happened. The first iteration of the law, there was no clinicians involved. It was all just lawyers making a bunch of decisions that were completely clinically impossible to apply. Like a law that I cannot tell the patient to which dispensary to go because they've made that illegal. First, they removed that later. But we've come, as you said, far from that to a pretty robust field. So where are we going? So what's our next year? What do you think in next year at 420, if we get together to record this again, what do you think is going to happen?
Oh boy. Maybe not by next year, but I think I'm predicting in the next few years, we'll get the announcement that it's either descheduled and suddenly the floodgates open to banking and interstate commerce. People can use their credit cards to purchase cannabis. I'm not sure where we're at in that because I haven't been involved in the federal policy.
But that would be the moment. But I think that was the moment where all of our colleagues that are at North Shore for you and for GW for me will come running to us and say, okay, now we have to learn because we don't have a choice anymore. So at least for now, it's a controlled substance. So it's still our own academicians are often skeptical, although I'm seeing ice melting rapidly. Like I have a lot of folks. I'm sure you too, right?
Absolutely. People who I actually saw at the on the anti side of town hall meetings are now, they've come to the other side because it's either their patients have softened their view over time. Like with anything new, we're gonna you see those views softening because the patients are saying, well, I'm using it and it's, have you noticed I haven't called you about my Ambien refills? And I think that's, to me, the biggest thing that's happened over the past, what is it, almost like 8 years or so that we've been doing this, is it's just freed up a lot more resources to treat chronic pain and sleep. That's, to me, and anxiety. I have learned, though, once the honeymoon is over with a patient, like the excitement of being certified and I'm going to try this is over, what cannabis has a role, but it doesn't solve every problem.
And it causes side
I have
effects.
A handful causes side effects. I have patients who initially were using it all the time, and then they're like, kind of fell off of using it. And I don't say, get back on it, use it every day. They evolve to figure out maybe my stress levels do need to be managed. I think I'm ready to really dive into a meditation practice.
So I think this is the most. Oh, I just lost your sound, Les. I can't hear you. The sound. I just lost the sound. I can't hear you. Oh, there we go. You're back.
Okay.
Yeah. So yes. I think you just brought up the most important point, I think, and that is we in our practice use cannabis often as a getaway in, as to make people a little bit better, 10, 15, 20%, and then say, okay, now your true healing is going to begin. Now that you grasp that you could recover from all this chronic pain and insomnia and whatnot, now you actually have to do the work. You have to start moving, you have to start putting mindfulness exercise, you have to eat better. We grab them. We have a tool that's effective in that, drawing their attention to the health instead of being sick all the time. And we're in the perfect place to apply it because our teams are there. Like that's what we do, right? And I actually feel that overall in the whole field of cannabis, that's not done enough. It's like it's like everybody's like, cannabis is the best current ever. It kind of reminds me of the whole vitamin D hype 10 years ago. Like, okay, you take vitamin D and all your problems go away. No, they're not. They just as much there. You just put nice placebo effect for a while, maybe not 100%. It's kind of the same, and I think that's a perfect. This is exactly, I think, where we should end to say that what I hope for the next 24 months is 12 months, whatever, is that more and more people realize that you can use this tool as something to get you towards, that you can say, okay, what do I need to get truly better? And now that I have a tool to make me feel a little better for periods of time, and I don't have to rely on medications that will cause increased amount of side effects, I can do more.
Yes, I think and then also the longer you try something, you see what it's good for. If cannabis only helps the anxiety, but not necessarily the pain, at least you took the anxiety component out of the pain. I also have patients where this was 100% the reason why they're better, and they keep using it, and it's still just as good as it used to be, which is wonderful. I think my main caution is we can get very flippant about its risks, and people are driving under the influence. I know people drive under the influence. They're also taking their Xanax and they're taking their gabapentin and the stuff that can sedate, but we take it for granted. And I often ask myself, how did you get here to the office today at 9 o'clock? and that's where I do say, you really don't want to don't drive on this substance if it's particularly any at all sedating. It's still illegal. just like with alcohol, I could go over to the Binnies across the street,
Yep.
go buy it legally, and then drink something, get in my car and get in an accident or
Get in
hurt
trouble.
somebody. I think that's the main thing and this is what I tell my children too, who know I do a lot of conversation about cannabis, and they're teenagers. And I tell them this is as a medicine, as a therapeutic. And I demystify it for them. I know that they're going to be offered, they may try it. It's not something that I want them to do. And I talk about it as a therapeutic substance, primarily. So I'm not a parent who's going to say, yeah, go ahead and try it. Parents are different. I myself don't use it. I haven't had a need for it, thank goodness. But it's not my place to judge other people who are using it for adult use purposes.
Right.
So anyway, and if you think about other substances you could use, like alcohol, I would rather have somebody use cannabis instead, because it's
Right.
The long-term effects are not there like they are with alcohol. But everyone is
generally safer. Yeah.
Yeah.
Exactly.
But it's still potentially addictive, and I think as physicians we have to still remind people there is a dark side to cannabis as well. The addiction potential, the driving, the side effects that can occur. So if we talk to our addiction specialists, who all they see all day are people addicted to marijuana, or cannabis, they're gonna be like, hey, how come nobody talks about that?
Yeah, one thing I want to put plug for our listeners: if you want to see a pro physician, which is you are, debating very effectively a strong skeptic and doing it very well, to the point, and avoiding the sort of barking at each other, and really doing a good job at looking at the science and saying, okay, here's a pros, here's a cons, this is how we can look at it. So I'll make sure that in this link for the video, I'll put the link to your debate with one of the skeptics, because I think some of our listeners here would really enjoy listening to it. So I'll make sure we include that. But I know you have to run a busy clinic coming for you today. So thank you so much for coming to our channel, and happy 420.
Happy 420. Thank you, Dr. Kogan. Bye.
Bye.